Welcome to County Portal, your simple source for local government services and public records. Let's get started.
Ever wondered what kind of drug tests police departments use? It's a common question, and the answer really depends on who is being tested, a police officer applicant or a suspect in a criminal investigation. Let's break down both scenarios. First, when it comes to hiring and maintaining their own force, police departments have very strict standards. The most common type of drug test for police applicants and current officers is the urine test. This is the standard for most workplace drug screening. They typically use a comprehensive panel test, often a 10-panel screen or even more extensive. This looks for common substances like marijuana, THC, cocaine, opiates, amphetamines, and PCP, but can also include benzodiazepines, barbiturates, methadone, and synthetic opioids. The goal is to ensure a candidate has a clean history and that current officers remain drug-free to maintain public trust and safety. Some departments are also moving towards hair follicle testing. A hair test is much harder to cheat and provides a much longer detection window, typically showing a 90-day history of drug use, which gives a clearer picture of a person's lifestyle. These tests are used for pre-employment screening and are also used for random drug testing throughout an officer's career. Now, the situation is completely different when police are testing a suspect, for example, during a DUI stop. Here, the goal isn't to check for a history of drug use, but to determine if a person is actively impaired right now. For roadside screening, you might see the use of oral fluid or saliva tests. These are becoming more popular because they are less invasive and can detect recent drug use, which is a good indicator of potential impairment. However, the gold standard for evidence in a DUI drug case is a blood test. A blood test is the most accurate way to measure the exact amount of an active drug in a person's system at the time of the incident. This is crucial for prosecution. Because a blood draw is invasive, it typically requires the person's consent or a warrant from a judge. Police might also use a urine test on a suspect after an arrest, but it's less effective for proving impairment in court because it can detect drug metabolites for days or weeks after use, making it hard to prove the person was high at the exact moment they were driving. So, to sum it up, for their own officers, police departments use urine and hair tests to ensure a drug-free history. For suspects, they use blood tests to prove current impairment for court, and sometimes saliva swabs for initial roadside checks. Thanks for watching. If you found this information helpful, please hit that like button and consider subscribing to the channel for more straight-to-the-point content like this. We'll see you in the next one.